Symptoms: trigeminal neuralgia. Contents: overview: symptoms, causes, diagnosis, treatment. The main symptom of trigeminal neuralgia is sudden attacks of severe, sharp, shooting facial pain that lasts from a few seconds to about 2 minutes. The pain is often described as excruciating, like an electric shock. The attacks can be so severe that you're unable to do anything while they're happening. Trigeminal neuralgia usually affects one side of the face. In some cases, it can affect both sides, although not usually at the same time. The pain can be in the teeth, lower jaw, upper jaw, or cheek. Less commonly, the pain can also be in the forehead or eye. After the most severe pain has subsided, you may experience a slight ache or burning feeling. You may also have a constant throbbing, aching, or burning sensation between attacks. You may experience regular episodes of pain for days, weeks, or months at a time. Sometimes the pain may disappear completely and not return for several months or years. This is known as remission. In severe cases of trigeminal neuralgia, the attacks may happen hundreds of times a day, and there may be no periods of remission. Symptom triggers. Attacks of trigeminal neuralgia can be triggered by certain actions or movements, such as talking, smiling, chewing, brushing your teeth, washing your face, a light touch shaving or putting on makeup, swallowing, kissing, a cool breeze, or air conditioning, head movements, vibrations, such as walking or traveling in a car. However, pain can happen spontaneously with no trigger whatsoever. Further problems. Living with trigeminal neuralgia can be very difficult, and your quality of life can be significantly affected. You may feel like avoiding activities such as washing, shaving, or eating so you do not trigger the pain, and the fear of pain may mean you avoid social activities. However, it's important to try to live a normal life and be aware that becoming undernourished or dehydrated can make the pain worse. The emotional strain of living with repeated episodes of pain can lead to psychological problems such as depression. During periods of extreme pain, some people may even consider suicide. Even when pain-free, you may live in fear of the pain returning. Read more advice about ways to manage chronic pain. When to see a GP. You should see a GP if you experience frequent or persistent facial pain, particularly if standard painkillers such as paracetamol and ibuprofen do not help, and a dentist has ruled out any dental causes. Trigeminal neuralgia can be difficult to diagnose. The GP will try to identify the problem by asking about your symptoms and ruling out other conditions that could be responsible for your pain. Causes. Trigeminal neuralgia. Contents overview. Symptoms, causes, diagnosis, treatment. There are 3 main types of trigeminal neuralgia. Classical trigeminal neuralgia, which is caused by pressure on the trigeminal nerve. This nerve provides sensation to the face. Secondary trigeminal neuralgia, which is caused by another medical condition or problem. Idiopathic trigeminal neuralgia. This term is used when the cause is unknown. Classical trigeminal neuralgia. Classical trigeminal neuralgia is caused by pressure on the trigeminal nerve close to where it enters the brainstem. The brainstem is the lowest part of the brain that merges with the spinal cord. In most cases, the pressure is caused by an artery or vein squashing, compressing the trigeminal nerve. These are normal blood vessels that happen to come into contact with the nerve at a particularly sensitive point. It's not clear why this pressure can cause painful attacks in some people, but not others, as not everyone with a compressed trigeminal nerve will experience pain. It may be that, in some people, the pressure on the nerve wears away its protective outer layer, myelin sheath, which may cause pain signals to travel along the nerve. However, this does not fully explain why some people have periods without symptoms, remission, or why pain relief is immediate after a successful operation to move the blood vessels away from the nerve. Secondary trigeminal neuralgia. Secondary trigeminal neuralgia is the term used when trigeminal neuralgia is caused by another medical condition or problem, including a tumor, a cyst, a fluid-filled sac, arteriovenous malformation, an abnormal tangle of arteries and veins, multiple sclerosis, MS, a long-term condition that affects the nervous system, facial injury, damage caused by surgery, including dental surgery,